We've got to get a lot better at describing sexual behaviour. Sexual behaviour can be a lot of things. It can be sexual in terms of looking at things like intercourse, masturbation, prolonged kissing, all those sorts of things. But there are other layers to that and interactions that can be not as sexual. For example, intimacy can be one way of describing it. But really, I think the word affection doesn't get used nearly enough in aged care to describe these sorts of interactions between people. So I think we need to get better at describing it, and I think we just need to increase our vocabulary a little bit and try to widen that. Like, we have a very narrow focus when it comes to it, and it always jumps to intercourse when we're talking about these things. And I think we just really need to widen that open to a lot of things and give care staff the vocabulary to use to be able to actually know how to describe these interactions between people.
I think the one thing would be to continue the dialogue around the expression of sexuality in older persons living with dementia in an aged care facility. And it is really important that we ensure a person's rights are not unnecessarily infringed, and that we do our utmost to enforce their rights and to maintain and uphold those rights to the best of our ability. And whether that means that we have mechanisms in place for oversight, and particularly where we have non-compliance of those rights, that there are consequences and that changes are made. So that would hopefully affect positive change in practice.
We need to realise that people with dementia still have feelings, desires, needs. And if we are having actions that may be deemed unacceptable, along with pain, hunger, thirst, let's consider sexual needs.